Hello, this is the American Medical Association's COVID-19 update. Today we're talking about how one organization, NODEHealth, is using its expertise in digital health to support innovation during the pandemic. I'm joined today by Brian Van Winkle, Executive Director of NODEHealth in Bozeman, Montana. Dr. Samir Badlani, Chief Information Officer at mHealth Fairview, Executive Board Member of NODEHealth, and also the NODEHealth Planning Committee Chairman in Minneapolis. And Dr. Ben Rosner, a researcher at the Center for Clinical Informatics and Improvement Research in the Division of Hospital Medicine for UCSF and Director of Research at NODEHealth in San Francisco. I'm Todd Unger, AMA's Chief Experience Officer in Chicago. Mr. Van Winkle, can you begin by telling us a little bit about NODEHealth and what it aims to accomplish?
Absolutely, Todd, and thanks for having us on. We're super excited to be able to talk about an organization we're passionate about. I am the executive director for NODEHealth. NODEHealth stands for the Network of Digital Evidence in Health. We're a nonprofit focused on research and education, and we really came about under this recognition that everybody's working on the same problems. And if we could really bring the ecosystem together to understand what's working, what's not, we might be able to help accelerate the rate of change. Our mission is to create, gather, and share evidence and best practices in digital health. In terms of creating, we actually do research. So we're one part CRO, where technologies will come to us and say, can you help us validate the solution? We also gather and share the best practices and the things that are working in the industry with our leadership, or I should say our membership. And we do that through working sessions. We do that through our scholar team. We do that through the conferences. Really, again, in the hopes that we can share what's working and what's not with the industry. And I hope to talk a little more about the conference that we have coming up in December later on. But thanks for having us.
You bet. Dr. Badlani, obviously the pandemic's kind of changed the game for everyone. How is NODEHealth supporting physicians during COVID-19?
Thank you for that question. And I echo Brian's comment in appreciating the opportunity to speak with the AMA and you guys personally. For us, NODEHealth exemplifies being able to show the evidence behind a lot of these interventions. You know, if you go pre-COVID, we had so much money being put into digital health, it was hard to sift through the signal from the noise. In the crisis that we are in currently and will be for the foreseeable future, unfortunately, it's really important that physicians and provider organizations like mine, payer organizations, and other organizations understand what works, how much investigation to do before you start implementing something. NODEHealth fills that gap. What we want to be sure is that people have an understanding of, if I do this intervention, these are the likely outcomes and this is the evidence behind it. In some cases, you require a very high level of evidence like digital therapeutics. In some cases, you are willing to go in with an outcome at a peer organization. So NODEHealth helps clinicians and executives in healthcare and outside life sciences as well make those important decisions.
Dr. Rosner, any other comments on how you're supporting physicians during COVID-19?
Yes, you know, as Dr. Badlani mentioned, many health systems are trying to figure out how to provide digital therapeutics or digital evidence to their patients and actually arm their providers with kind of best-in-class digital interventions. One of the challenges, Todd, as you may remember in 2016, when James Madera was the CEO of AMA, was speaking to the AMA annual conference, was a term he used, digital snake oil. And the reason he brought that term up is because in the US, we don't have yet kind of a solid regulatory framework for showing evidence of efficacy and safety for digital therapeutics. And so what organizations like NODEHealth do is that they help arm patients and providers and payers with evidence around digital therapeutics so that we know that what we're serving up to patients and providers is both safe and efficacious.
Dr. Rosner, how has the pandemic affected innovation and the way that you think about evidence as part of the process?
Yeah, that's really interesting. I mean, the pandemic certainly shifted a lot of people's focus to innovation around COVID, but it also brought about certain changes that we don't typically see except for when there's a public health emergency. So as you know, there have been over 30 federal regulatory changes that actually rapidly enabled the deployment of telehealth so that patients and providers can interact in a way kind of like we're doing right now in a live way. But also the FDA sort of changed the goalposts a little bit by granting emergency use authorization to a variety of digital therapeutics, most notably in mental health, saying that right now we're going to waive a lot of the other requirements that we might have otherwise had in place under discretionary review in order to try to get therapeutics out that we think are probably going to be pretty safe, so that people can benefit from them under this public health emergency.
Mr. Van Winkle, how's COVID-19 changed NODEHealth's approach to supporting the evidence process?
Yeah, like everything in this world, it's changed everything. In terms of our support, the very basics, of course, are we went virtual with our avenues of sharing best practices and evidence, of course. The second is we created a resource stash, if you will, which is a library on our site where you can go and read about the references or the best practices specific to COVID adoption or things that are working across the membership. A lot of our validation services are now focused on technologies related to COVID. So we had one technology come to us and said, we want to improve the avenues with which patients and consumers get education about COVID. And so we convened a virtual panel of experts, epidemiologists, researchers, clinicians, and provided some feedback on this technology solution so that they could more effectively develop an educational platform focused on COVID patients. And so those are just a few of the things that we've changed. And then, of course, for the educational material and the conference coming up in December, that will have undertones and major themes related to COVID. Why evidence matters, where evidence matters, when evidence doesn't matter, all in the context of a pandemic that changes the nature of the conversation a little bit, meaning the balance between safety and speed never before is more important than today. And NODEHealth has really been focused on bringing that conversation to the forefront.
And Brian should also mention, we have NODEHealth has a team of writers and researchers who kind of dig through the literature and also through the industry to surface best technologies or best practices. And during the pandemic, this group of researchers and writers has published a series of blogs on NODEHealth's website on different topics related to the pandemic. So one week was a topic on contact tracing. Another week was a topic on evidence in the emergency room for managing pandemic-related issues. And so people can go to NODEHealth's website and read the blog on each of those topics that surface kind of best evidence pertaining to the pandemic.
Yeah, and I'm glad you mentioned that, Ben. One of the things we're proud of at NODEHealth, Todd, and Samir knows this as well, is how much we focused on practical, pragmatic information that matters to clinicians, information that matters to the frontline nurses. So sure, we have inspirational topics that every innovation organization has, but implicit or explicit in everything we do, we really want to bring practical, real-time information to our members or anybody really that's part of NODEHealth as we are a part of the larger ecosystem.
Well, Mr. Van Winkle, let's talk a little bit about your work with the AMA. You've been working closely with us. Can you tell us more about the partnership and why it's so important?
Yeah, for sure, Todd. And we're excited about the work that we're doing with AMA. You know, it started maybe a year or two ago where we just started getting more and more together to work on developing resources related to best practices, for example, around telehealth adoption. How do we make sure we roll that out and integrate some of these technologies into clinical workflow? That has really emerged into more and more opportunities for two places. One is to have AMA leadership or AMA members be a part of our faculty or a part of our conferences in terms of speaking or sharing what they're learning in their practice, but even more importantly, a part of the research that we do. So AMA has hundreds of thousands of experts when it comes to clinical practice. At the same time, we have technology companies coming to us and saying, we need access to these clinicians. So NODEHealth really serves as the convener between technology needing the input and clinician having that expertise. And so we're working on more and more formal avenues to provide research opportunities to AMA members, as well as decreasing the barriers to getting some of that clinical expertise, like Samir and Ben. But I can't have 100 Samirs and I can't have 100 Bens. But through AMA partnership, that really does expand the pool of researchers that we can bring to the market.
Well, Dr. Badlani, based on your experience during the pandemic, where do you see healthcare innovation and the role of evidence moving forward?
That's a great question, Todd. In my mind, and I've expressed this at other forums, and I'll take the opportunity to say this again, innovation without transformation is a very expensive scientific hobby. What NODEHealth strives for and what COVID has mandated to us is that any innovation we invest time in, we have to do the last mile effort in seeing whether it transforms our business or not, transforms the experience that our consumers face every day. So making sure that the outcomes are available at scale is something that NODEHealth helps the mission with. The second thing I will add to this, somewhat unrelated, but very important, and we're very passionate about it. And I'm really proud to say that NODEHealth, as the organization I'm representing in this conversation, and mHealth Fairview, the organization that I work for, we are embracing the challenge of dealing with another pandemic, and that's the pandemic of racism and inequity in healthcare. So what you will see in the DMC 2020 is not just a focus on finding the evidence, when is it appropriate and when is it adequate, the validation pathway to doing interventions. You will also see conversations around equity and access to healthcare and how we are hoping digital medicine becomes a way to tackle racism and not just a way to perpetuate the inequities in outcomes and access to healthcare that have existed for so long across the globe. It's not just a US problem.
Well, Mr. Van Winkle, if a physician wants to get involved with your efforts, what should they do?
Yeah. First of all, we'd be honored to have AMA be more involved with our efforts. We certainly could use the help. First and foremost, it's being an active member of our community, and you can get involved by coming to our conference, speaking at our conference. If you want to reach out to me at brian@NODEHealth.org to let me know your interest, please do so. The conference is December 7th through 11th. We would be honored to have AMA. We've created a discount code, AMA30, that gives everybody at AMA 30% off of every NODEHealth activity. And that's really the conference that Samir alluded to and I mentioned in my opener, which is a 5-day event that includes 30 plus interactive sessions all around digital medicine, evidence, transformation. We have some of the world's premier speakers talking across those 5 days. Ben himself is leading a highly interactive workshop on designing clinical studies. Samir is in the agenda as much as we could put him in the agenda. And so we really do welcome everybody to be involved. That conference also has workshops that you can sign up for, where we're working on a particular problem that is of interest to the stakeholders. So that's one area, Todd. The second area is the conference kicks off on December 6th with a Sunday Digital Medicine Foundation Certificate course. This is formal education around digital medicine and evidence and transformation across 8 classes. It's going to be from 10:30 to 6:30 Eastern Time, divided into classes like telemedicine and care in the home, wearables, connected devices, artificial intelligence. There's going to be a panel which AMA has featured, led by the founder of NODEHealth, Ashish Atreja, just talking about clinical applications for digital medicine. Beyond that, becoming a member, again, reach out to me, go onto our site, NODEHealth.org. If you want to register for the conference, you can go through there as well, NODEHealth.org/conference. we'd love to have you.
That's excellent. Again, that's NODEHealth.org to find out more about the conference and how you can get involved with NODEHealth's initiatives. I want to thank Dr. Badlani, Dr. Rosner, and Mr. Van Winkle for being here today and sharing their perspectives with us. That's it for today's COVID-19 update. For resources on COVID-19, visit ama-assn.org/COVID-19. Thanks for joining us. Please take care.